Oke, selanjutnya kita akan memasuki sesi tanya jawab yang akan berlangsung selama kurang lebih 20 menit. Bagi peserta yang memiliki pertanyaan, baik terkait materi yang telah disampaikan, dipersilakan untuk menyampaikan dengan mengaktifkan fitur raise hand. Dan sebagai catatan untuk seluruh audiens agar dapat menyampaikan pertanyaan menggunakan bahasa yang dimengerti oleh narasumber, yakni bahasa Inggris. Dan mohon dibantu untuk mengirimkan pertanyaan melalui chat Zoom pula agar dapat direview berulang oleh narasumber. Baik, kami sudah menerima beberapa pertanyaan. Boleh kepada Dr. Ronald Pascal Kalejan.
Doctor, we have received a question from the participants. Please allow me to read the question. Does the VEMP examination can be done in office setting with the ambient noises or must be done in soundproof chamber?
Mengingat aksesibilitas layanan audiologi canggih belum merata di seluruh wilayah, bagaimana peran praktisi klinis dalam memastikan bahwa prosedur pemeriksaan seperti VEMP atau AEP ini tidak hanya menjadi prosedur eksklusif di kota besar, dan langkah apa yang bisa diambil agar pasien di daerah terpencil tetap mendapatkan diagnosis yang akurat serta tepat waktu.
Question 1. Given that access to advanced audiology services is not yet evenly distributed across all regions, how can clinical practitioners ensure that examination procedures like VEMP or AEP do not become exclusive procedures limited to major cities? And what steps can be taken to ensure that patients in remote areas still receive accurate and timely diagnosis?
So, doctor, while waiting for question for the participants, please allow us to ask question first.
Okay, so I think just now we talked about remember we talked about we have to prepare the patient for the tests, right? And then we have to like aspiration on the skin and then put the electrodes, and then we need a chamber, a quiet, soundproof chamber, all these. And I think this is quite factual to have the patient to attend in the audiology vestibular clinic in person. So I don't really think it can be possible for telehealth for all the AEP and VEMP tests. I think we can't ensure patients to remote area to get this accurate and timely diagnosis if they don't come in person. Or if you have a clinic in a remote places, still you have to like if you put your device in that remote places so that they can travel to your clinic, or maybe they have to go to your clinic in the middle, in the center of the city, so that they can get the audiology and vestibular tests. So yeah, I understand the need because in your country is you got very a lot of different regions, but still, because this test, we need to control the environment and it need professional skills. It need lots of different direct contact with the patient. So I don't think it really can help with the telehealth.
Terima kasih dokter atas explanation yang sudah disampaikan.
Second question. What's the advantage or benefit using the Hear Lab? Other than for the like patient using hearing aids, for classic behavioral threshold like the sound field aided tests in children, like or maybe in adults. For cases in adults, they generally, after putting in hearing aids, you ask the patient to like put up your hand when you hear boo boo boo, and then they usually can perform well, like reliable responses. But if you got a kid, and for just 3 to 5 years old, and maybe they perform a little bit about the behavioral threshold, like they can play audiometry, and but they may lose their attention for a very short while. Maybe they have to come back the next time, 1 year at a time, or like still reliable, but you have to extend your test time from like 1 session to 2 sessions of the year. And you have to repeat like every half a year or every 1 a year to make sure everything goes well. So maybe you can go with the Here Lab ACA, so that even they're like moving around, playing a game, not um, engaged to what you're doing, and maybe no need for the your assistant or maybe the parents to help to assist the child. Still, you can get the ACA response, the HEALAB ACA response. So this is more easier for the clinician to get some objective results from the kids, from those challenged to be tested patients. So I think the advantage of Here Lab ACA is like that. You don't have to worry about, oh, today your patient got sick, so they can't focus well. The young child cannot focus well because they got sick, or maybe after maybe they get to the kindergarten in the morning, and then in the afternoon they got tired, they got sleepy, and they got bad tempered, and they have to skip this session of tests. Still, you can use the Here Lab ACA. Okay. In case of hearing or balance disorders, topic. I don't really know for the cases. Your question about in cases of hearing or balance disorders where symptoms are often dismissed by general public as minor health issue, how effective are AEP and VEMP examinations in detecting problems early to prevent permanent damage? And what is the most appropriate education strategy? So you're asking two questions here indeed, not just one. And appropriate education strategy to convince the public of importance for these tests before their condition worsen. So let me answer the first question first. Um, how effective in detecting the problem? I think of course it's very effective for detecting problems. And you mean for prevent damage, permanent damage? I think if they got some vestibular problem, and it's kind of different if they got, whether it's a short term or permanent problem. I think it's better for the doctor to tell them because it needs some very professional medical backgrounds to answer this question. And it's different from cases to cases, so I don't think we can like shortcut to answer this question. Okay, so this is very down deep and different for case to case basis. Okay, but you mean how effective AEP and VEMP examination? What we have to do is we ensure the AEP and the VEMP examinations are accurate and easy to perform. So when after the patient first come to your clinic, you can provide them very timely help, like perform the tests in a short time so that they don't have to wait for a long time to queue up for the test and then queue up back for seeing the doctor. I think this can be controlled. But if like for very general to promote and prevent permanent damage, I think it's kind of very case by case basis and not really related to the AEP and the VEMP examinations. Okay, and then for what is the most appropriate education strategy? Um, I think for the public, the education strategy is not only in your country. I think in most of the countries, patients like in my country, we got some very a lot of Chinese patients. They not only think about the Western medical uh, uh, pathway, they also think about like um Chinese medicine or other very uh not that not what we are checking about the medical with the um this kind of medical and pharmaceutical field. So I think the appropriate education strategy is that they really have to know that um they have to take the responsibility for themselves. Yeah, if they got dizziness or vertigo problem, maybe uh they don't can't really just seek for only one opinion from some like uh, uh mm, very like first level like but just buying medicine in the pharmacies. Yeah, they better go for some thorough testings. Mm.
Baik, terima kasih atas penjelasan singkatnya, dokter. Untuk tadi kami sudah menerima pertanyaan dari Dokter Fiona Widiasari dan sudah dijawab pula oleh Dokter Annabelle. Apakah Dokter Fiona dapat memahami dan apakah sudah clear, dokter?
Hello, Dr. Annabelle. I'm Fiona from Palembang, Indonesia. Thank you for answering my first question.
Has already
Um,
in the chat box.
I don't think we can do them together if because you see the setup. Mm, the OVAM we and the CVAM, the CVAM, we look into the let me share the screen. For the CVAM is here the saculi. We measured the sternocleidomastoid muscle before, okay? And then for the ovum, we measure the ocular, the eyes. We put the electrode on the face so as to check out the eyes. So we are measuring totally different things. We better measure the sometimes we measure the CVAM and sometimes we measure the ovum. It depends on the initial findings by the physician so as to check maybe they suspect, like if they suspect for the inferior vestibular nerve to have problem, then they check order the CVAM, okay? But if they suspect the superior vestibular nerve problem, then they order for the ovum, okay? So sometimes, of course, we perform all the tests in a test battery, but because of like the patients, if they go through the whole tests, like for the CVAM, they have to hold the position like this, not a very comfortable position, of course. So maybe sometimes we only do the OVAM if they suspect to have the superior vestibular nerve, the problem.
Coba jelas Dokter Fiona, udah jelas atau belum?
Oke, dari Dokter Fiona sudah jelas. Terima kasih atas pertanyaan dan penjelasannya, Dokter Annabelle.
Mm-hmm. Okay,
Thank you,
you're
Doctor,
welcome.
for the explanation. Very insightful for us and also the audience.
Mm-hmm.
sebelum itu, apakah mungkin ada pertanyaan tambahan? Are there any more question? Baik, sepertinya untuk pertanyaan sudah cukup.
So, Doctor, here's a brief recap of the discussion so far. The key messages highlighted by Dr. Annabelle include clinical foundation of evoked potential, modular architecture, analyzing structure, and system configuration and standard equipment, etc.
Oke, mungkin ini adalah rangkuman singkat dari kami mengenai pembahasan yang telah disampaikan oleh Dr. Annabelle yang menekankan beberapa poin, yakni Celesta diposisikan sebagai sistem evoked potential yang praktis, modular, dan user-friendly, dengan fokus utama pada kemudahan penggunaan, efisiensi alur kerja klinis, serta pengurangan kompleksitas operasional. Dan produk ini sangat sesuai untuk fasilitas kesehatan yang membutuhkan solusi IP modern dengan proses instalasi sederhana, pengoperasian mudah, dan kemampuan pengembangan sistem sesuai kebutuhan di masa depan. Baik, untuk Dr. Annabelle, terima kasih untuk penjelasan yang telah diberikan. Mohon maaf karena keterbatasan waktu untuk pertanyaan yang belum sempat terjawab. Akan kami tindak lanjut dan sampaikan informasinya melalui pesan WhatsApp.
Dr. Annabelle, we would also like to invite you to join us for a documentation session. Furthermore, we would like to inform you that the webinar documentation will be published on Nusa Medika Indonesia Instagram account, and we will take your account as a form of appreciation for your contribution.
Baik, untuk seluruh peserta, nantinya dokumentasi webinar juga akan kami unggah melalui Instagram Nusa Medika Indonesia. Kami mohon izin untuk menandai akun dokter pada unggahan tersebut sebagai bentuk apresiasi atas kontribusi dan partisipasinya dalam webinar hari ini, yang pastinya akan berguna untuk dokter dalam meningkatkan exposure, professional branding, dan memperluas jangkauan edukasi yang telah dibagikan. Kami akan sangat senang apabila dokter berkenan untuk turut membagikan atau melakukan repost setelah unggahan tersebut dipublikasikan. Oleh karena itu, mohon berikan senyum dan pose terbaiknya karena tim dokumentasi akan segera melakukan penangkapan layar untuk dokumentasi webinar hari ini. Goes like this. This is Nusa Medika logo, Dr. Annabelle. Okay, we will capture 3, 2, 1. Baik, terima kasih banyak kepada seluruh audiens dan Dr. Annabelle. Thank you very much.
All right, the documentation session has been completed. Once again, thank you, Dr. Annabelle, for your valuable time and wonderful presentation for today. We truly appreciate your presence and contribution to this webinar session. If you need to leave the meeting, please feel free to do so. And to all participants, let us show our appreciation to Dr. Annabelle by sending a round of applause to the clap emoji.
Baik, kepada seluruh peserta, mari kita tunjukkan apresiasi kita kepada Dr. Annabelle melalui emoji tepuk tangan. Mari kita ramaikan bersama. Dan audiens sekalian, selanjutnya kita akan masuk ke sesi kuis yang akan berlangsung selama kurang lebih 5 menit. Kami akan membagikan Google Form quiz melalui chat Zoom. Dokter dipersilakan mengisi form tersebut sebagai bagian dari penilaian door prize webinar hari ini. Pada Google Form tersebut terdapat 5 pertanyaan kuis, konfirmasi minat klaim kode referral, voucher diskon, serta kesan dan pesan dokter pada saat webinar. Bagian konfirmasi minat klaim kode referral disediakan bagi dokter yang berencana melakukan klaim kode referral sebesar 10% untuk mengajukan kebutuhan pengadaan alatnya ke rumah sakit. Dengan begitu, sehingga tim sales dapat memprioritaskan tindak lanjut kepada dokter tersebut. Dengan begitu, kami persilakan seluruh dokter untuk mengisi Google Form quiz yang telah dibagikan melalui chat Zoom.
Kami informasikan bahwa waktu pengisian kuis telah selesai, dan seluruh jawaban yang masuk akan kami proses sebagai bagian dari penilaian door prize webinar hari ini. Pemenang door prize akan dikontak lebih lanjut oleh tim melalui WhatsApp setelah acara selesai. Kami sangat mengapresiasi waktu dan antusiasme dokter dalam mengikuti sesi ini. bahwa pemenang door prize 1 unit Remi Pro akan dipilih dari peserta yang mengisi Google Form Quiz.
Baik, pemenang door prize akan dikontak lebih lanjut oleh tim melalui WhatsApp setelah acara selesai. Selain itu, harap diperhatikan, khusus peserta webinar juga tersedia promo spesial, yakni yang pertama, diskon 5% untuk pembelian pribadi seluruh produk kecuali produk Inventis PT Nusa Medika Indonesia. Yang kedua, diskon 10% untuk pembelian produk pribadi produk Inventis PT Nusa Medika Indonesia. Yang ketiga, referral fee atau support fee sebesar 10% dan nilai pembelian alat bagi dokter atau user yang mereferensikan atau mengajukan kebutuhan pengadaan alat ke rumah sakit.
Selanjutnya, mohon kesediaan dokter untuk mengisi formulir absensi kehadiran. Silakan klik tautan yang telah kami bagikan di kolom chat Zoom. Berikut tautan untuk absensi kehadiran sudah kami cantumkan, dokter. Pengisian formulir ini sangat penting sebagai syarat verifikasi klaim voucher diskon, referral fee, door prize, dan juga penerbitan e-sertifikat bagi seluruh peserta webinar.
Baik dokter sekalian, tidak terasa di penghujung acara, mohon izin mari kita tutup webinar hari ini dengan pantun. Pergi ke pasar, membeli ketupat.
Tidak lupa membeli jamu.
Terima kasih atas waktu yang diberikan dokter dengan hangat.
Semoga ilmu hari ini bermanfaat untuk praktek selalu.
Saya Marcella.
Dan saya Cynthia. Pamit undur diri.
Bagi dokter yang telah mengikuti seluruh rangkaian acara hari ini, dipersilakan untuk meninggalkan Zoom meeting.
Selamat sore dan salam sehat untuk kita semua.